Today we are going to start a series of MCQs in which we will discuss the recent past MCQs and all the clinical MCQs. Remember that each of the MCQ in this file is very important, and even the simple MCQ can be asked in the scenario form in the original exam. So let's start with the first MCQ. Which rectus muscle receives only one ciliary artery? Which rectus muscle receives only one ciliary artery? The options are medial rectus, lateral rectus, inferior rectus, and superior rectus. So the correct option here is lateral rectus. All the recti muscles receives two ciliary arteries except the lateral rectus, which receives only one. Which statement is false about the cavernous sinus? The options are occurs on either side of the body of the sphenoid bone, contains the internal carotid artery, it is bounded by the posteriorly by the ethmoidal air sinus, contains the oculomotor nerve. So the option here will be it is bounded by ethmoidal air sinus posteriorly. No, it is not bounded by ethmoidal air sinus. Rather, it is bounded by sphenoidal air sinus. Remember that. The next very important MCQ is the blood-aqueous barrier. Blood-aqueous barrier is maintained by the options are tight junctions of outer pigmented ciliary epithelium. Remember the difference of pigmented and the non-pigmented. This is very important in this MCQ. Hemidesmosome of the inner non-pigmented ciliary epithelium, tight junctions of inner non-pigmented ciliary epithelium, and zonula occludens of the inner non-pigmented ciliary epithelium. So the option correct here is the tight junctions of the inner non-pigmented ciliary epithelium. Remember the other structures which are involved in the blood aqueous barrier. These are iris vasculature, and the third one is the inner wall endothelium of Schlemm canal. Endothelium of Schlemm canal. Okay, of Schlemm canal. The first one was this tight junctions of inner non-pigmented ciliary epithelium. So this was the blood aqueous barrier. Remember that there is also a blood retinal barrier. Blood retinal barrier can be divided into inner blood retinal barrier and outer blood retinal barrier. Inner blood retinal components are it consists of in intercellular endothelial junctions, which are tight junctions, adherents, gap junctions, pericytes, and also contributions from the glial cells. And the glial cells are the Muller cells and astrocytes. And the outer blood retinal barrier consists of tight junctions between the adjacent RPE cells, only between the in between the RPE cells. Very, very important. So next question is the anterior lens capsule contains what structure? The options are crystalline alpha, beta, laminin, and fibrillin. The correct option is fibrillin. Fibrillin is the major component of the lens capsule and also other important structures like zonules and also present in the vitreous. So very important these are. Basically, the crystalline alpha, beta, and fibrillin. These are water soluble proteins. Water soluble. Both of these crystalline alpha and beta. They are responsible for the transparency, while fibrillin maintains the structural integrity. Maintains structure. Okay. These are the water soluble proteins. There are also water insoluble proteins. Water insoluble proteins which are responsible for the brownish and cataract. So remember, a unilateral blind eye is most likely to be caused by unilateral blind eye. Is caused by the options are a stroke affecting the anterior choroidal artery, aneurysm of the ophthalmic artery, pituitary tumor, a stroke affecting the lateral striate artery, and a stroke affecting the anterior cerebral artery. So the correct option here is the beta, because the aneurysm of ophthalmic artery causes the compression or the compressive atrophy of the optic nerve. So it results in a unilateral blindness. Very important, okay? While what others will cause, like a pituitary tumor, will cause bitemporal hemianopia, okay? And the stroke of anterior choroidal are the striate arteries which supplies the optic tract and the radiation would cause a homonymous hemianopia. Remember this, very important. While the anterior cerebral artery is unlikely to have the visual symptoms. So our next question is acetylcholine is released at all of the following sites except acetylcholine is released at all of the following sites except the options are parasympathetic postganglionic neurons, sympathetic postganglionic neurons innervating the iris, parasympathetic preganglionic neurons, sympathetic preganglionic neurons that innervate the sweat glands, sympathetic preganglionic neurons. So the option here is sympathetic postganglionic neurons, sympathetic postganglionic neurons innervating the iris. Because most sympathetic postganglionic neurons, including those innervating the iris, release norepinephrine. These are adrenergic, not cholinergic. Only the sympathetic postganglionic supply. Look here. This is cholinergic, while others sympathetic postganglionic neurons are adrenergic and they do not release acetylcholine, they release the norepinephrine. The next question is all are involved in the parasympathetic pathway to the lacrimal gland. The options are pterygopalatine ganglion, superior salivatory nucleus, the nervus intermedius, lesser petrosal nerve. So here the option is lesser petrosal nerve because lesser petrosal nerve is not involved rather than Greater petrosal nerve is involved in the parasympathetic pathway. Okay, petrosal nerve. And also these structures are involved in the parasympathetic pathway. Which statement is false regarding the blood supply through the choroid? The options are blood flow in the choroid is among the highest in the body. The blood drains from the choroid by the vortex vein. Choroidal capillaries are highly fenestrated. The percentage oxygen transfer in the choroidal capillaries is high. Here the option we have to choose is delta. The percentage oxygen transfer in the choroidal capillaries is high. No, this is not high. The oxygen transfer in the choroidal capillaries is low, with only 5 to 10% of the oxygen. The oxygen transfer is low while the blood flow is high in the choroid. Remember these two differences. The blood flow, however, is high at 1400 milliliter per minute. Remember this. This can be asked in the MCQ as well, which is higher than the perfusion through the kidney. So this is very important, and the main function of this high blood flow is temperature regulation and heat dissipation. Remember this, please. The next question is which of the following is false about the ocular drug delivery? The options are an acidic or the alkaline pH can increase the drug absorption. Ointments have a longer corneal contact time than the drops. An acidic or the alkaline pH can increase the drug clearance. An increased blink rate increases the topical drug absorption. So we have to choose here delta. This is the false because increased blink rate decreases the topical drug absorption. It does not increase, it decreases. An increased blink rate reduces the topical drug absorption by increasing the clearance. Other statements are correct. Eye drop solutions are often made more acidic or alkaline in order to ensure the drug, whether weak acid or the weak base, is more unionized and therefore lipid soluble to increase the corneal absorption. So they are made more acidic or the alkaline to make them lipid soluble to increase the corneal absorption. However, acidic or the alkaline pH will also tend to initiate the irritation and the lacrimation, increasing the drug clearance. Very important. So the next question is, all the statements are true about the Shem canal except which statement is wrong? We have to choose that. The options are it is lined by the endothelium, it is a circumferential channel filled with the aqueous humor, it is drained by collecting channels, and the aqueous vein, it drains the aqueous humor by the non-conventional pathway. The aqueous from the Schlemm canal joins either the deep scleral venous plexus or drain directly into the superficial conjunctival vein. So the correct option here is the delta. It drains the aqueous humor by the conventional pathway. Drainage of aqueous humor via the Schlemm's canal is described as the conventional outflow pathway. Very important. Drainage via the Schlemm canal is the conventional outflow pathway, and it is responsible for about 7 to 90%, 70 to 90% The non-conventional pathway, what is that? That refers to the drainage of the aqueous veins via the intercellular spaces between the ciliary muscle fibers and loose connective tissue of suprachoroidal space. Remember that. This is the non-conventional pathway. Can be asked in the MCQs. So the next question is, which statement is false regarding the nerve supply to the cornea? The options are: the nerve supply is mainly from the short ciliary nerve bundle enter the peripheral cornea in a radial manner. Individual nerve fibers terminate in the superficial epithelial layers as interepithelial plexus. Nerves must pierce the Bowman layer to enter the corneal epithelium. So here the option is alpha, because the corneal nerve supply is mainly from the long ciliary nerves, which is the branch of the nasociliary, a division of the ophthalmic branch of the trigeminal nerve. Ophthalmic branch of the trigeminal. Other options are correct. While reading the MCQs, also focus on the correct options. These can be asked in the separate MCQ by making any scenario, or can be asked in a simple way. The next question is, rods are responsible for all of the following except. The options are contrast, spatial resolution, motion, and brightness. So the option here correct is spatial resolution, because this is mainly the function of the cones. The rods are responsible for contrast, brightness, and small amount of spatial resolution, but mainly it is the function of cones. Cones are responsible for fine resolution. Okay, remember spatial resolution, color vision. Remember this step. The main structure responsible for the resolution are the rods, or the cones, not the rods. The next MCQ is, all are true about the blood supply to the retina except. The options are: the retinal circulation has a higher oxygen rate, the retinal circulation has a high flow rate, the tight junctions of the RP are important in the integrity of the blood retinal barrier, the inner two-thirds of the retina is nourished by the branches of the central retinal artery. So the correct option here is the beta. The retinal circulation has a high flow rate. This is false. The retinal circulation has a low flow rate. And but the high oxygen exchange. Remember that these are two different points, as similarly we have studied in the choroidal circulation. By contrast, the choroidal circulation has a high flow rate and the low oxygen exchange. Remember that. Similarly, this all the other options which are correct are very important. The inner two-thirds of the retina is nourished by the branches of the central retinal artery. The tight junctions of the RPE are important in the integrity of the blood retinal barrier. So the next question is, which statement is false regarding the choriocapillaries. The options are: its lobules are fed by arterioles in the Halley's layer, its density is greatest at the macula, its capillaries are wide bore, its capillaries are fenestrated. So, which statement is false? The correct option is alpha. Its lobules are fed by the arterioles in the Halley's layer. No, it's the hexagonal lobules are the divisions of the choriocapillaries are each fed from the arterioles arising in the Sattler's layer. Haller's layer lies beneath the Sattler's layer and contains the major arteries and veins. Remember that this Haller's layer and the Sattler's layer, these are the layers of the choroid. There are 5 layers of choroid. First one is the Bowman's membrane. First one is the not the Bowman's, Brooks membrane. Second one is the choriocapillaries. Third one is the Haller layer, Sattler layer, and the fifth one is the suprachoroid. So these are 5 layers of choroids. The next question is: in which condition you are least likely to find a cotton wool spot? The options are ischemic central retinal vein occlusion, reproliferative diabetic retinopathy, central retinal artery occlusion, and the malignant hypertension. So, least likely cotton wool spot are found in the central retinal artery occlusion. The correct option here is the central retinal artery occlusion. While in the other conditions like ischemic central retinal vein occlusion, diabetic retinopathy, malignant hypertension, cotton wool spots are commonly present. Diabetic retinopathy is characterized histologically by all of the following except the options are loss of pericytes, cotton wool spot due to nerve fiber ischemia, thinning of the capillary basement membrane, degeneration of the capillary endothelial cell, hellenization of the vessels. So, which is not the characteristic? Thinning of the capillary basement membrane. There will be thickening. Okay, remember that, and the multi-layering of the basement membrane of the small vessels. Okay, remember that. Other important, very important points about the diabetic retinopathy changes are: look here, cotton wool spots due to nerve fiber ischemia can be asked in a separate MCQ. How the cotton wool spots are produced, thinning of the capillary, degeneration of capillary endothelial cell. Okay, the most important is this: how cotton wool spots are formed. The next question is: all are true of the tear film except the options are: it contains the secretions from the meibomian glands, it contributes to the refractive function of the eye, it is composed of an outer lipid layer, it is increased with the topical atrophy. So the correct option here is it is increased with topical atrophy in delta. The tear film is decreased by atropine because atropine is anti-muscarinic and so it reduces the parasympathetic input to the lacrimal gland, leading to dry eye. So this is very important. Other functions are like because it contributes to the refractive function of the eye because it clears the cornea. Okay, so because it clears the cornea, so refractive power is increased. It is composed of outer lipid layer secretion from the Mcqss glands. All are these are which statement is false regarding the accommodation mechanism? The options are fibers mediating the accommodation reach the ciliary muscle by long ciliary nerve. Contraction of the ciliary muscle induces the relaxation of the zonules. Accommodation is mediated by the fibers from the third cranial nerve. Contraction of the ciliary muscle moves the ciliary muscle forward. So we have to choose what is false regarding the accommodation. The option A here is correct because the parasympathetic innervation of the ciliary muscle is derived from the third cranial nerve via the Edinger-Westphal nucleus, and the preganglionic fibers synapse in the ciliary ganglion and reach the ciliary muscle by the short ciliary nerves, not the long ciliary nerves. Okay, this is very important. That look here that the fibers mediating the accommodation reach the ciliary muscle by the long ciliary nerve. No, this is by the short ciliary nerves. Our next question is all of the following are true of the retinal pigment epithelium, except of the options are the cells have a low regenerative capacity, its cells are more flattened in the center than in the periphery, it is derived from the neuroectoderm, the cells are hexagonal and highly organized. So the correct option here is beta. What is written? Its cells are more flattened in the center than in the periphery. No, the cells are more flattened in the periphery than in the center. The next option is the next MCQ is all of the following are features of Horner syndrome, except the options are conjunctival injection, a small pupil that does not react to light, updrawing of the lower eyelid, partial ptosis that disappears with the topical phenylphrine, decreased sweating of the skin around the eye. So the correct option here is the a small pupil that does not react to light. So this is not the feature of the Horner syndrome. Horner syndrome occurs when there is interruption of the cervical sympathetic neurons that supply the orbit. Features of Horner syndrome include myostide that reacts normally to light. Okay, there is no difference in the response to the normal light. Partial ptosis that disappears with the topical phenylphrine, conjunctival injection due to loss of the sympathetic tone of the blood vessels, updrawing of the lower eyelid with the resultant apparent anophthalmos and the decreased sweating. Anophthalmos means the eye is sunken. Sunken eye, the the globe is displaced backward. Globe is displaced backward. So all of these are features of the Horner syndrome. Horner syndrome is very important question in the exam. Read it very carefully. So the next question is, when there is unilateral damage to the cervical sympathetic ganglia, ocular findings include all of the following steps. This is the unilateral damage to the cervical. This is also scenario of Horner asked in another way. So the options are failure of pupil to react to light, paralysis of the Muller muscle, low intraocular pressure, updrawing of the lower eyelid. So here the option correct is alpha, failure of pupil to react to light. This is not the feature of unilateral damage of the cervical sympathetic ganglia or the Horner syndrome. There will be paralysis of the Muller muscle that leads to ptosis. Okay, that leads to ptosis, and low intraocular pressure due to decreased aqueous production. Decreased aqueous production because of decreased sympathetic supply. There is updrawing of the lower eyelid due to loss of sympathetic tone to the inferior dorsal muscle. To inferior dorsal muscle. So remember these points as well. These can be asked as a separate MCQ. Horner syndrome causes miosis, but people can still react to light, which is mediated by the parasympathetic autonomic nervous system. So this is another important point which can be asked in other ways. The next question is, all are the features of hypertensive retinopathy except the options of Hellenization, retinal hemorrhages, lymphocytic infiltration of the vessel walls, fibrinoid necrosis, and the hard exudation. The correct option here will be lymphocytic infiltration of the vessel wall, because it can occur in any kind of infection, but not in case of hypertensive retinopathy. There will be Hellenization, hemorrhages, there will be fibrinoid necrosis, and there will be exudates. So, hypertensive retinopathy results in Hellenization of the blood vessel wall. Hellenization means thickening and the scaly appearance. Okay, scaly appearance and the transparent. Scaly appearance and transparent. Further vessel narrowing and the ischemia leads to the retinal hemorrhages, fibrinoid necrosis of the vessels with the exudation and the papilledema. Lymphocytic infiltration is not a feature of hypertensive retinopathy. So the next question is, which statement is false with respect to the lens development? The options are, fetal lens is more spherical than the adult. The lens first appears as vesicles with a single layer of the epithelial cells. The lens is formed from the neural crest cells. The lens first appears at 27 days of gestation. So what is the false statement is, the lens is derived from neural crest. No, it is derived from surface ectoderm. Surface ectoderm. Remember these correct options. The fetal lens is more spherical than the adult. Okay, the lens appear as vesicle within single layer of epithelial cells. This date is very important, 27 days of gestation. The next question is, which statement is false regarding the lens? The options are, the adult lens measures approximately 10 millimeter in diameter. This is supplied with nourishment from both the aqueous and the vitreous. The anterior radius of curvature is greater than the posterior curvature. The lens become less round with age. So we have to choose the false statement, and this is false delta. The lens become less round with age. No, it becomes more round with age. Remember that. Which are the following false regarding the retinopathy of prematurity? The options are: the medial retina is usually the last to be perfused in the premature infant. It can result in abnormal vascular proliferation. It can be treated by laser photocoagulation. It may lead to the retinal detachment. So we have to choose the false statement about the retinopathy of the prematurity. It will be alpha. The temporal retina is usually the last to be perfused. Okay, remember this very important point in a premature infant, and it is from this area of the ischemic retina that growth factors are produced that drive the new vessel formation. So, another important MCQ that from the temporal retina, the growth factors are produced that lead to the new vessel formation. If left untreated, vasoproliferation can lead to the retinal detachment and blindness. The next MCQ is: which of the following statement describes the retinal edema following the blunt trauma? Whenever there is a blunt trauma, it leads to the retinal edema. So, which term describes the retinal edema after the blunt trauma? The options are commissuretina, retinoschisis, cystoid macular edema, serous retinal detachment, retinal macroangiopathy. So the correct option here is the commissuretina. Actually, trauma generates hydraulic forces. Hydraulic forces that damage the retina, particularly at photoreceptor. This is important, okay? Photoreceptor RPE junction. So this retina occurs at the level of the photoreceptor RPE junction and causes the transient edema, which is known as retina. The next question is: the midget ganglion cells and the midget bipolar cells are most common in the fovea. These are most common in the fovea. Actually, the midget ganglion cells and the midget bipolar cells, these are the cells of the parvocellular pathway. These cells, these are the cells of the parvocellular pathway, which is responsible for high, which is responsible for high accuracy of the vision, due to synapses which are in ratio 1 and occur most often in the fovea. This neural explosivity helps to explain the high resolution of the foveal region. So this is very important. This is related to the parvocellular pathway, which is responsible for the high accuracy of the vision. So our next question is, which statement is not true of the vitreous degeneration? About the vitreous degeneration, the options are: it usually commences in the late 30s, it is implicated in the pathophysiology of the PVT, posterior vitreous detachment, it involves the collagen fibrils coming out of the suspension, it involves the liquefaction of the collagen gel called the syneresis. So, which is not true about the vitreous degeneration? The option A is not true because it begins in the late teens, not in the late 30s. It begins in the late teens. And vitreous degeneration is involved in the pathophysiology of the PVD. Collagen fibers come out of suspension, okay, and there is liquefaction of the collagens, which leads to the syneresis. The next question is, which statement is false regarding the iris? The options are: narrowing of the pupil increases the depth of focus. Dilated pupillae is a continuation of the pigmented ciliary epithelium. Iris vessels are non-festated. Narrowing of the pupil reduces the optical aberrations. So, which is false regarding the iris? The false one is the option beta. The dilated pupillae is continuation of the pigmented ciliary. No, this is the continuation of the non-pigmented ciliary epithelium. Dilated pupillae. The posterior pigmented iris epithelium is continuation of the ciliary body pigmented cells. How it increases the depth of focus? By reducing the circle of blur, reducing circle of blur, and narrowing of the pupil reduces the optical aberration by suppressing the peripheral rays. Peripheral rays. So remember these points as well. So the next MCQ is the next MCQ is, which statement about the human lens is false? The options are: it has a higher refractive index in the nucleus than in the cortex. It contains a higher concentration of the sorbitol in the diabetics. It contains the nucleated cells mainly on its posterior surface. Glucose is metabolized mainly by the anaerobic glycolysis. So the false statement is, it contains nucleated cells mainly on the posterior surface. No, the nucleated cells are mainly present only on its anterior surface, okay? Which of the following statement is false about the optic nerve? The options are: the optic disc is approximately 1.5 mm in diameter. The raised papilla of the optic disc is more prominent nasally than the temporally. Maculopapillary bundle constitutes about 90% of all the axons leaving the eye. The intraocular portion of the optic nerve is unmyelinated. So we have to choose the false about the optic nerve. The raised, so the option B here is correct. The raised papilla of the optic disc is more prominent temporally than nasally. due to the entry of the maculopapular bundle. Okay, this is very important. Our next question is: all the statements are true of the vitreous except the options are: the cloacated canal is remnant of the hyaloid vein. The vitreous is attached to the inner limiting membrane of the retina, especially near the retinal vessels. The cortical vitreous is attached to the pars plana by the vitreous base. Vitreous cells, also known as halocytes, and they are similar to the macrophages. So, what is the wrong statement? The cloacated canal is the remnant of the hyaloid vein. No, this is the remnant of the hyaloid artery, which supplies the lens and the vitreous in the fetal eye. Okay. Other correct statements are very important, like the cortical vitreous is attached to the pars plana by the vitreous base, and vitreous cells bear resemblance to the macrophages. Please remember this. The next question is regarding the lacrimal drainage system. So, with regard to the lacrimal drainage system, the options are: the congenital blockage is mainly due to the delay in the development of the punctum. The nasolacrimal duct is narrowest at the lowest end. Nasolacrimal duct drains into the superior meatus. The upper lacrimal punctum is medial to the lower punctum. So we will choose the right statement. The upper lacrimal punctum is medial to the lower punctum. Is medial to the lower punctum, and the explanation of other points are: the nasolacrimal duct is narrowest in the middle than the other ends. The duct drains by the inferior meatus. Congenital blockage is usually not due to the developmental delay. Remember that it is due to the failure of the lower end of the nasolacrimal duct becoming patent. Okay, it does not open. That's why congenital blockage is there. The nasolacrimal duct may be closed at 6 months post delivery. This is very important. The next question is the hyaloid artery. The options are: form part of the vascular propria lentis. Burmester papilla is the anterior remnant. It regresses after birth, and it communicates freely with the coital circulation through the development. So the correct option here is the alpha. It forms part of the vascular propria lentis. The hyaloid artery supplies the lens and the inner layer of the optic cup. It forms vascular propria lentis, which supplies the lens. It regresses before birth. Let's show you the hyaloid artery. Look here that this is the hyaloid artery going and supplying the lens here. Another is showing the hyaloid artery forming the vascular structure and supplying the lens. So it regresses before birth. This is very important. Mittendorf dot is the anterior remnant. So remember that there are two remnants. One is the anterior remnant, second one is the posterior remnant. Mittendorf dot is the anterior remnant of the hyaloid artery, while the Burmester papilla is the posterior remnant. The choroidal circulation arises from the long and the short posterior ciliary arteries. Very important, the choroidal circulation. And it does not communicate with the hyaloid artery. Burmese papilla, other important points about these structures are it appears as a flake of glial tissue projecting from the disc. So this is the commonest anomaly of the heroid system. Among the Mittendorf dot and the Burmeister papilla, the most common is the Burmeister papilla, so remember it. While the Mittendorf dot is the remnant of the interior end of the hyaloid artery and is attached to the posterior lens capsule. Very important point. It usually associated with posterior polar cataract. Look here that this is the aglile-like structure showing here. Our next question is which statement is false regarding the central retinal vein occlusion? Which statement is false regarding the central retinal vein occlusion? The options are it is predisposed by the physiological narrowing of the retinal vein in the lamina cribrosa, hypertension, and the diabetes are the risk factors. On rare occasion, the central retinal vein may recanalize. It is characterized by hemorrhagic retinopathy. Rhodotic glaucoma is common. So, which statement is false regarding the central retinal vein occlusion? The false statement is on rare occasion. On rare occasion, the central retinal vein may recanalize. Examination of the histological specimen reveals the recanalization of the central retinal vein in most of the cases. So, it is recanalized in most of the cases, but not in the rare cases. All all other statements are very important, like it is predisposed by narrowing of the retinal vein in the lamina cribrosa, hypertension, and the diabetes are the risk factors. There will be hemorrhagic retinopathy, and after the CRVO, there will be probiotic glaucoma is very common. The next question is which statement is false about the extraocular muscle? Which statement is false about the extraocular muscle? The options are type C fibers are required for tonic contractions, type A fibers are fast twitch and required for saccadic movements. Extraocular muscle contains the large number of specialized sensory and the pre-receptor nerve endings such as the muscle spindle and the Golgi tendon organs. Type B fibers are slow twitch and needed for smooth pursuit movement. Extraocular muscle is less vascular than the skeletal muscle. So the wrong statement is it the extraocular muscle is less vascular than the skeletal muscle. No, it is more vascular than the skeletal muscle. In fact, it is the most vascular muscle in the body after the myocardium. Very important. So other important points are these are very important, like type C fibers are required for tonic contraction, type A fibers are the fast twitch and required for the static movements. Okay, these are very important. Remember the type B fibers are needed for the smooth pursuit movements. Our next question is which of the following statement is false regarding the hard exudates? Hard exudates. Which statement is false? The options are they are well circumscribed lesions. They are caused by leakage of the plasma. They contain foamy macrophages with lipid layer in their cytoplasm. They can occur in the inner plexiform layer. They are caused by endothelial damage to the deep capillaries. The first statement is they occur in the inner plexiform layer. No, they are present in the outer plexiform layer. They are present in the outer plexiform layer. The next question is the following are true about the vortex veins except the options are they are usually 4 to 7 in each eye. They drain into the superior and the inferior ophthalmic vein. They exit the eye at the equator. They drain the retina and the choroid. So what is wrong about the vortex vein? They drain the retina and the choroid. This is the option is correct. The vortex vein drain the choroid, ciliary body, and iris. Remember these three structures. Vortex vein drain the choroid, ciliary body, and the iris, but it does not drain the retina. Which statement is false regarding the cone photoreceptor? Regarding the cone photoreceptors, the options are the outer segments are shorter in the cones than the rods. The cone lamellae are not enclosed by a membrane. The synaptic terminal of the cones are called spherules. Cone lamellae have a longer lifespan than the rods. So, which statement is false? The outer segment. The option C here is false. The synaptic terminals of cones are called spherule. No, these are termed as pedicles. The synaptic terminals of the cones are called pedicles. Very important. And that of the rods are called spherules. They synapse with the bipolar and the horizontal cells. Our next question is which statement is not true about the vitreous? The options are the central vitreous is more dense than the cortical vitreous. It has a higher viscosity, roughly 2 to 4 times than that of the water. Type 2 collagen and the hyaluronan are major constituents. It is composed of 98% of the water. So, which statement is not true or which statement is wrong about the vitreous? This is option A. The central vitreous is more dense. No, the central vitreous is more liquid than the cortical zone, which consists of more densely arranged collagen fibrils. Okay. The two major structural components of the vitreous are collagen and the hyaluronic acid. The collapse and the contraction of the collagen fibrils, which occur with age, causes the pockets of the fluid to form within the vitreous, and the vitreous then reorganized and form the posterior vitreous detachment floaters. So, all these PVD floaters, this is related to the rearrangement of the collagen fibrils. Remember this collapse and the contraction of the collagen fibrils. This was all about today's lecture. We will continue next lecture.